All right. So for the next heart issue, which we'll be discussing this morning, is acute rheumatic carditis. Okay. So I want you to always be a type of person that is understanding things from the first principle. I'm coming. Now, the best way to understand things from first principle is defining your terminologies. Do you understand? So, even if you don't understand anything here, I want you to understand that anything acute is occurring in a very fast time. Anytime you see itis attached to any word, it shows that there's inflammation. Do you understand? So let's look at it. Okay. Rheumatic, of course, there's an inflammation of the heart, and this came from an infection. So that's why we are showing this picture, because there are also some other signs you look up on the skin of the patient. Okay. So just a serious manifestation of acute rheumatic fever. It primarily affects children between the age of 5 and 15. Now, it is an infection where the person is actually infected by what? Group A streptococcus, which we have already spoken extensively on them. So what is it? It is an inflammatory condition of the heart. It arises because your immune system is trying to fight the group A streptococcus. Do you understand? So when they say that two elephants fight, when two elephants fight, the ground suffers. So you are the battleground. Your immune system and the group A streptococcus are fighting. So you have to show up some symptoms because you are suffering from their fight. Yes, this fight is for your own good. You understand? So it involves endocarditis, so there's inflammation of the valves. Myocarditis, there's inflammation of heart muscles. Pericarditis, there's inflammation of the heart outer lining. Okay, you understand? So if you have inflammation of all these components, they call it the pancarditis. Okay, so why it matters in children? Children are more vulnerable to any immune stuff, right? Because their immune systems are still coming up. They are not strong like our own. So in developing countries, rheumatic heart disease, a chronic consequence of rheumatic carditis, is a leading cause of acquired heart diseases in children. You can see it, carditis, inflammation. Okay. So clinical features: such a child is having chest pain, fever, is tired, shortness of breath, heart murmurs, you're having extra sounds in the heart, signs of heart failure. Now, other issues, okay, like apart from this carditis, you should also look out for polyarthritis. That's issues with their joints are getting inflamed. All right, chorea, if they are just moving somehow, that's neurological issues. Subcutaneous nodules, erythema marginatum, you look out for all of this. See it listed. Painful joints is the polyarthritis that we're talking about, right? Then also fever. All right, erythema marginatum is all these patches like maps on the skin of the person. All right, like I showed you guys here now. Yes, so you are connecting everything now. So diagnosis is just simple. You are trying to actually pick up the group A streptococcus, that's in blood cultures and all. Then you also look out for other accompanying symptoms. Okay, then all right, echocardiography to look at the damage of the heart. So treatment, because you are dealing with a bacterial infection, first of all you have to tackle the bacterial infection by using antibiotics. Penicillin is a nice option for that. Then because you are dealing with an inflammatory condition, you use an anti-inflammatory drug. Okay, so long-term secondary prophylaxis, you want to prevent recurrence. Okay, benzathine penicillin is nice. Keep monitoring the person. Then if the valve damage is extensive, surgery might now be involved in it. Okay, so that's it for acute rheumatic carditis in children.